one of the things that I've been finding is when we travel the country, people have no clue that the NAACP deals with health care. And they ask, you have a health department? And I kind of step back and wonder, you know, what have we done as community advocates and health advocates to really tell our stories differently? For people to understand this is not just about black, white, Spanish, it's about green, it's about money, it's about have and have not, it's about consumers' rights, it's about being an American and being a part of this general fold of American people, and how healthcare has really exposed the root of American racism, the root of American classism, and quite frankly, sexual discrimination and gender discrimination. And so as we're talking about the exchanges, and I was talking to Jim, he took half of my speech, so I'm gonna get him on some of the stuff that I wanted to say. But it's good, it's a good setup, because as we're, from the national standpoint, because that's how I have to speak to you from, the NAACP has really focused in on consumers' rights and how advocates really have to take a different look at how they address this. We're known throughout the country for our discrimination work. You know, Brown versus Board of Education, giving people equal rights. But really, if you look at healthcare, right now, this might be the most pressing civil rights issue that we've seen in the last 35, 40 years. And it is rearing up with, and I have pictures here, but I'm going to talk to you about what I've seen. We have been receiving the most hate mail on healthcare reform in the last 2 years, to the point where our president's 4-year-old daughter has received death threats for us speaking out on healthcare, and being called coons and monkeys and niggers, because we speak for healthcare for all Americans. And you know, it's an interesting space, and I wanted to share that with everybody so that you understand how serious this thing really is. People's lives are at stake, and yet we stand in the way of ignorance, because people just don't know the truth. And that's our job. That's the people in this room's job, is to really bring forth the truth. And so we're talking about exchanges, and I have a couple of stats here around Illinois. When the Affordable Care Act was passed, the state received $89.4 million. Now, and I looked at the list, for health insurance exchange plan, there was $1 million sent to the state of Illinois. And is everyone clear on those numbers? The state has already received money. You are in a position to now begin the planning process. The question is, have healthcare advocates really called their legislators out on what we're doing in the planning? You have a couple of things that you really need to be looking at. And from our standpoint as an association, we are nonpartisan. We will call you out if you are not taking care of the interests of the people that we serve. So whether you're a Democrat, Independent, or Republican, shame on you if you're not standing up for health care for all Americans. Because at this point, we're seeing a couple of things. One is that people do not really know what the bill offers. And if you're talking about an insurance exchange, this is about shopping. Now, Americans can understand buying because we consume more than anybody in the world. I'm from Camden, New Jersey. I love Nikes. I love Nikes. I think they are the greatest shoe ever. I ran track in college. But I know there's a Nike, there's an Adidas, there's a Reebok, there's a New Balance. I got options when I shop. It's that simple. We have to communicate to the community exactly what they're going to get. They're going to get options if we push our states to move on the exchange. Now, there's a couple of strategies that I want you to think about and be open to. 2, accountability and action. For you as healthcare consumers and healthcare advocates, your accountability must translate to clarity on the exchange. It must also build your power base. You know that saying, power to the people? That was never a pun. That was exactly what it said. Power to the people meant you as the people, the voter, the resident, the person that pays taxes, the person that cares for children, the person that wakes up every morning in the state that you live in, have power. The problem is we don't know our power, and we don't use the power that we really have. And it's a part of the rights of being an American. When you were born on this soil, when you came to the soil, and you became an American citizen, however that worked for you, you at that point acquired power. The problem is the power base is speaking 3 or 4 different languages. So when you start speaking different languages and trying to get to one mission, that gets a little murky. So how are you as health advocates bringing clarity to the language? The third thing is this: in contacting your legislators, what language are you speaking to them? Now, I had a meeting with the Surgeon General. I'm not going to say that person's name. one of our Surgeon Generals, I had a great conversation with them, and they said, when I was in office, when I spoke to Republicans, I spoke the language of economics. When I spoke to Democrats, I spoke the language of the heart. When I spoke to independents, I spoke both languages, but when I spoke to the people, I dealt in their homes. And that really got to me, because what you have to do is know who you're talking to and explain to them exactly what they understand. If we want these exchanges, we want these governing boards to be as diverse as we say they need to be, you need to speak the language of the legislator that you're trying to get to understand this accountability. To the Republican, if you do not have X, Y, and Z representation, you are going to really address or disgruntle 78% of your base. These are languages that they understand, numbers, they understand money. If you're talking to a Democrat, talk to them about those stories. It's okay to share stories. And let's be clear, legislators are in for votes. They are in for the people, but they understand the people vote. That's your power base, work your power base. I'm trying to go down to 15 to 7, so I'm gonna get it down to 7. The last thing is about fear. Now, I think with the boards, and I want to talk a little about this as a governing board, there is fear in the air when you're talking about governing boards. Let's just be very, very honest about what's happening. People are afraid to give people power. They are afraid to lose. Majorities and persons that are in power are afraid to lose their power. And when you transition people into power, what that does is it changes people's comfort zones. You look at the world now, there are some people that will walk into this room and be very uncomfortable. We're very diverse. We're very assertive. You have women and men on the same panel. There are some places in this country that this stuff still does not happen. And I'm going to share a personal case. We're working on a case in the state of Pennsylvania right now of a young boy who was discriminated against because of his HIV status. He is being denied entrance into a boarding school because they said they feared that this black boy would have sex with other people. And when you're talking about health advocacy, and you're talking about governing boards, and you're talking about people in power, what you realize is there's ignorance in leadership. People just are speaking on things they don't know. The departments of insurance, when you're looking at our insurance agencies, those agencies that are really profiting on people's sickness, what they do know is their profit. What they don't know is how they affect people's personal lives. And they won't know it unless you bring it to the forefront. The people in this room, really, you have an opportunity to make some changes. This governing board, the things that she was talking about in terms of persons representing all colors, persons representing those that have disabilities, you need to know that there are friends and enemies in all these places. Because some people that say they're your friends, you find out in the end they're not your friends at times too. And I really want you to begin thinking about that as you're advocating. When you're looking at the governing boards and how we want them to end racial disparities, I want to add something to your list. I want you to look at health equity as your standard strategy. When we use words like disparities, and especially health people, health folk, we mess up because we go around and talk all our acronyms, you know, CDC, HHS, this is stuff we talk about. This is foreign language to those that are not doing this work every day. If you talk about equal playing fields, then you begin to change the conversation. So I urge you to add health equity as one of your additional strategies because you want to end disparities. But you end disparities by creating equal health playing fields for all Americans. So if I wake up and I'm black and I'm a woman and I'm from Camden, New Jersey, I should wake up and have the same rights as Liliana, as Jim, as whoever is here. I should have an equal playing field when I wake up. But in America today, I don't have the same playing field. And when we do not continue to brush those issues under the rugs of equity, then we won't see any of those changes that we're looking for. Here's the last thing. The state of Illinois, right now, 71.5% white American, 14.5% black American, 15.8% Hispanic, 4.6% Asian, and then we have Native Americans around 2%. What happens when you start dealing with those numbers? Sometimes people say you should use your numbers to help push you. Well, if I use those numbers, the governing board begins to look like that. That's going to be a problem because that's not an equal playing field either. What we have to talk about is what services are being provided to what people. persons that are underserved, whether they're black, whether they're Hispanic, women, poor white Americans, poor white children, poor black children. We have to start talking about this in general, not just stats, but talk to legislators about who you are caring for as constituents. I got about 1 minute left, and I'm going to close with that. We have to make sure that if we want a governing board that's going to expand cultural competency, that's going to improve the quality of care, that these boards that you push as advocates to say, if you don't make these boards this way, there will be repercussions. Voters won't vote for those that do not supply victory for the communities that we serve. And I'll end with that.